So I wanted to update you all, give you a little bit more of a clear-headed report on the oral surgery, that bone graft that I went through yesterday, in hopes of getting another tooth, replacing the one that I lost. I realized I didn't mention yesterday that the experience was quite quick. I think I was in the office with Dr. Villing's office in Surrey, in Newton, Surrey, British Columbia. And I was only in there for, I think, about an hour. So as I got seated in the treatment room after filling up all the papers and signing the waivers and stuff, a technician or nurse came in and put an IV in for me. And right away, the team came in and I was put on monitors for blood pressure, and I was provided oxygen and an injection of, I think, Versed might have been one of the first things injected in order to sedate me. Generally, I didn't want to be awake for the procedure. They had to drill out and remove, of course, what was left of the old tooth in there. And so, within a minute of the injection, I was pretty much in a dream state. I really don't recall very much of the next 40 minutes or so. The next thing I remember, I was waking up and I was still in that same chair, and then they guided me, they helped me to walk into a recovery room where I waited another 30 minutes for my wife, Sharmila, to come pick me up. It was a smooth, excellent procedure. I don't have any issues with general anesthesia. I've been under general anesthesia for knee surgeries and multiple other things in my life. One dental thing and a couple knee surgeries, stuff like that. So that wasn't a big deal. I had no nausea. Just had to prepare some meals. They were soft. And yeah, the first 24 hours has been great since the procedure. The bleeding stopped within an hour or two after the last video, which was yesterday. So I just got a call from Dr. Villing's office. They're so nice to check in on me, see how I'm doing, and they just re-advised me about not eating anything hard and to rinse my mouth out with salt water after eating stuff. I guess that's in hopes of destroying any bacteria that might be in there, so that the surgical site doesn't get infected. That's where they implanted the porcine bone. There's also a membrane, supposedly, I think, just kind of sealing off that place, and sutures tying it to make sure the bone doesn't reposition. So the whole idea is to keep the porcine bone kind of in position so that my body's jawbone can start to integrate with it and kind of build its own bony structure to integrate with that porcine bone that's there, and then so that I'll actually build a strong foundation that can be like screwed into to anchor another tooth. So yeah, this is day 2, and my next checkup with the doc will be in about a week. I don't think much will change. I have no more swelling. Of course, all the numbness has gone away from the local anesthesia, so I'm pretty much feeling like normal from before the procedure. There's like a slight wound on the roof on my palate of my mouth, and not sure what that was from. It's probably just from manipulating my face with my jaw open, maybe some instruments. But yeah, it's not a big deal. It doesn't hurt. It's just, you can feel it with your tongue that the wound is there, and there's no more bleeding. So yeah, I haven't had to take any painkillers or anything. So any of you who are considering this option, it's this type of surgery, it's pretty smooth. I think one of the benefits in my situation is that I've had experience with general anesthesia, so that didn't really scare me. I generally am not needle phobic, so I can just chill and relax and concentrate on just slowing down, being mindful while people are inserting needles into my arm. So that hasn't been an issue for me. So I didn't bring any anxiety into this situation, and I think that really helped my experience. Those of you who are challenged with anxiety, I do recommend maybe using some meditation procedures, meditation apps beforehand, so that you kind of come in as calm as you can. Easy to say, hard to do. Comment below if you have any questions. I'll probably check in again. So episode 3 will probably be after my next checkup, which will be in about 6-7 days.